Good afternoon. My name is Ashley Buller, and I am the team lead for the care management team here at Desert Regional Healthcare Alliance. I have brought you all together today because DRHA has seen an increase in the incidence of prostate cancer over the last few years and is looking to expand their services to facilitate the coordination of care for individuals in the community who are at risk of developing prostate cancer or who are in the current treatment of. You are a group of prestige individuals, and DRHA needs our help in order to make this transition possible. This presentation is designed to inform you of the prostate cancer population we will be caring for as a care management team. Our goals will be outlined throughout the presentation and measured on an individual basis. Effectiveness will be based on a review you complete at the conclusion of this presentation. Information found within this presentation has been condensed and will be available to you for reference and review in pamphlet form at the end of the presentation. Completion of this presentation, you should be able to define what prostate cancer is, who's at risk for developing it, signs and symptoms to look for as a clinician, typical assessment findings for diagnostic testing, and overall outcomes for this particular population. There are three main risk factors for prostate cancer: age, race, and family history. 6 out of 10 men will be diagnosed with prostate cancer at some point in their lifetime. Of those 6, 2/3 are more likely to develop prostate cancer if they are over the age of 65. This is thought to be related to changes in the prostate over time. The etiology is currently unknown. However, African American males are more likely to develop prostate cancer than Caucasians, Hispanics, or Asians. An individual is also significantly more likely to develop prostate cancer if they have had or had a grandfather, father, brother, uncle, or cousin diagnosed with prostate cancer. Older adult males, especially those ages 65 and older, are one of the most susceptible populations for age-related changes and chronic conditions due to a variety of determinants, including a decrease in activity, physical, mental, and emotional decline, a lack of income and resources, as well as a decrease in overall health. Of the health conditions faced by this particular population, cancer is the second leading cause of death next to heart disease and affects 21.4% of the population. Prostatic carcinoma, or prostate cancer alone, is the most common cancer diagnosed among men. Prostate cancer also has a higher incidence of mortality, which we will talk about later. Additionally, many of these factors are contributory to such influences as social determinants, which can include but are not limited to gaps in services, insurance coverage, or lack thereof, additional supplemental insurance coverage to help with co-pays and out-of-pocket costs, increased poverty rates or living on a fixed income, lack of support for the elderly population, and lack of knowledge and understanding about health-related conditions and treatment. In alignment with the national goals presented by the National Program of Cancer Registries and Healthy People 2020, it will be our goal as a care management team to increase awareness about prostate cancer and its effects on health in the community, improve early detection rates for at-risk individuals and populations, offer coordinated services for diagnosed individuals in order to better manage care and treatment. As you may know, cancer can greatly impact an older adult's quality of life. By addressing health promotion and risk reduction practices, we can help to improve this quality, therefore leading to better satisfaction, better independence, and overall better health. Men cannot change their chances or risk factors for developing prostate cancer. However, they can be proactive in maintaining lifestyle habits that foster areas of improved prostate health. Although the definitive answer is unknown, obese males can have more surgical complications, problem with radiation regimens, and lower survival rates than other non-overweight or obese males, which can be detrimental when treating or managing prostate cancer. Maintaining a healthy weight can help to improve these factors. Researchers believe that consuming red meats or fatty foods can put an individual at increased risk for developing prostate cancer. It is believed that these foods produce certain types of fats and fatty acids in the body that may be harmful to the prostate. It's important for these individuals to eliminate or eat these products in moderation. Consuming 5 to 9 servings of fruits and vegetables each day can decrease the occurrence of cancer development. Tomatoes, pink grapefruits, and other fruits and vegetables contain strong antioxidants. Antioxidants act to destroy free radicals in the body that have been shown to change normal cells into cancerous cells. It is recommended for older adult males to get at least 150 minutes of moderate intensity aerobic activity each week. Older men who exercise have been shown to have lower cancer rates altogether, respond better to treatment regimens, and have a higher rate of cancer survival. Finding ways to accommodate the recommended lifestyle alterations can fit each individual's preferences, can confirm commitment and sustainability for the above recommendations, as well as improve overall health and functionality for this population. Prostatic carcinoma or prostate cancer is only found in males due to the male's genitalia anatomy. It is a walnut-shaped gland located just below the bladder and anterior to the rectum, and is responsible for the lubrication, transportation, and protection of seminal fluid produced by seminal vesicles along the male's reproductive tract. The male hormones responsible for this process are called androgens. The most common androgen found in males is testosterone, which is receptive to the enzyme 5-alpha reductase. This enzyme is responsible for converting testosterone into dihydrotestosterone, which signals prostate growth. This growth process can cause prostate cells to mutate and become cancerous. This mutation is classified as an adenosarcoma, which is the most common form of prostate cancer and accounts for the majority of prostate cancer diagnoses. The cancerous mutation of prostate cells deplete the body of zinc and citrate, causing the cancerous cells to conserve energy within them, allowing them to multiply and metastasize. The prostate-specific membrane antigen also increases the growth of prostate cancer by increasing folate levels for the cancer cells to use to survive and grow. Prostate cancer has a higher mortality rate compared to other cancers because its symptoms may be masked by other conditions of the prostate, such as benign prostatic hypertrophy or BPH, and is oftentimes not detected until its advanced stages. Common symptoms of prostate cancer include urinary dysfunction, incontinence, frequency, hesitancy, and dysuria. This is associated with the location of the urethra, which is the tube located in the middle of the prostate responsible for transporting urine and semen out of the body. When a cancer tumor develops, it can put pressure on the urethra, causing these symptoms. Tamsulosin, terazosin, and other alpha blocker medications are prescribed to relax smooth muscle. This is done to keep the hormone norepinephrine from constricting the small muscles found within the walls of the arteries and veins and increasing the flow of blood and urine. Reproductive symptoms include sexual dysfunction, erectile dysfunction, and infertility. The reason for this is that the nerves and blood vessels that control the physical aspect of an erection are incredibly delicate. Medications such as Viagra, Cialis, and Levitra can help to restore this function. Other more invasive techniques such as vacuum constriction devices and penile implants can be used if other measures are unsuccessful. Hormone imbalances and replacement can also cause an array of symptoms including hot flushes, loss of bone density, bone fractures, loss of muscle mass and physical strength, changes in blood lipids, insulin resistance, weight gain, and fatigue, among others. Hormonal balance is important for maintaining homeostasis in these patients. Some symptoms may start mildly and then progressively worsen over time. Aside from the symptoms of prostate cancer that can be present, it is important for physicians and healthcare professionals to perform a thorough assessment of an individual who reports suspicious symptoms that could be associated with abnormal prostate health, and examine the body to check general signs of health, including checking for signs of disease such as lumps or anything else that seems unusual. A history of the patient's health habits and past illnesses and treatment should also be taken. It is also important for the physician or healthcare professional to make the patient feel comfortable when talking about such conditions, because oftentimes individuals may feel embarrassed and fail to mention important information that could warrant the provider to seek further information about symptoms such as weak or uninterrupted flow of urine, frequent urination especially at night, trouble emptying the bladder completely, blood in the urine or semen, pain in the back, hips, or pelvis that doesn't go away, shortness of breath, feeling very tired, fast heartbeat, dizziness, and pale skin caused by anemia. In a digital rectal exam, a lubricated gloved finger is inserted into the rectum for 10 to 15 seconds to check for anatomical abnormalities of the prostate. This is done because of the location of the prostate and should be performed on an annual basis. A PSA screening is detected in the blood. Levels greater than 6 are suggestive of prostate cancer, and this is a first-line test for diagnosing prostate cancer. Prostate biopsy is the process of inserting a small needle into the prostate for collection of tissue samples for testing. The tissue collected from this biopsy is sent to a pathologist for official diagnosis and staging of cancer type. An ultrasound uses ultrasonic waves to visualize body structures to determine extent and metastasis of cancer. A bone scan is the visualization of bony structures to determine if cancer has spread and will appear as opacities on the scan. A CT and MRI is performed to assess the prostate and other surrounding areas for abnormalities. Lymph nodes are small structures located all over the body. Cancer often spreads to nearby nodes earlier than other tissues. By surgically removing some of the lymph nodes near the prostate and having them analyzed for the presence of cancer, can confirm that the cancer has not spread outside of the prostate. An individual undergoing treatment for prostate cancer may experience much pain, discomfort, and exhaustion related to certain treatments, as well as side effects from chemotherapy, radiation, and other pharmacological interventions. Some ways these individuals have been able to cope with their diagnosis and treatment is through and non-pharmacological interventions. Zytiga interrupts the androgen or testosterone-making process at the testes, adrenal glands, and tumor to slow the growth and spread of prostate cancer. Jevtana is used to kill prostate cancer cells to reduce the occurrence of prostate cancer growth. Avodart inhibits the conversion of testosterone to dihydrotestosterone within the body, which is responsible for the growth and enlargement of the prostate gland. Ulanexin causes cancer tumors to shrink by restricting antigen activity within the prostate. Zoladex reduces testosterone and steroidal production. Acupuncture is used for symptom management. Pressure is applied to meridian points by small gauge needles to relieve certain types of pain. Therapeutic exercise consists of the planned systematic performance of intentional physical movements, postures, or activities to enhance the functionality of an individual and restore mobility. Therapeutic massage involves the manipulation of soft or deep tissue and muscle to decrease pain, promote relaxation, circulation, and healing. TENS uses small transmissions of electricity to send electrical impulses throughout the body, therefore greatly lessening pain for a period of time. Gong is a transitional Chinese medicine and involves the manipulation of energy through slow body movements and meditation. Cancer can have varying effects on a patient's physical, mental, and emotional well-being. Providing patient-centered and holistic care to these individuals is important for meeting their comprehensive health care needs. Many cancer-related outcomes are individually based. Most individuals require a collective collaboration between healthcare professionals in order for them to effectively transition through the healthcare continuum. For these individuals, support is the #1 contributor for successful outcomes and management of disease. These individuals may find the support they need from within themselves, friends, family members, healthcare professionals, other diagnosed individuals, support groups, or any combination. It is important for them to know that they are not alone and have a support system to get them through the difficult time, because depression has been known to increase in cancer patients. Collaboration from the patient, family, and caregivers about education, treatment options, side effects, and life after diagnosis is greatly beneficial to prevent frustration and depression so often faced by this elderly population. Collaboration of care for these patients provides them with the autonomy to live fully while maintaining this disease and improving outcomes and coordination. Follow-up is important for the successful management of prostate cancer. Maintaining appropriate recommended and scheduled follow-up is important to adhere to the treatment regimen to help battle this disease and improve life expectancy and outcomes. As the care management team, we must work collectively for the better good of treating cancer, preserving patient independence, encouraging autonomy, and decreasing side effects from medication regimens for the optimization of better outcomes and overall patient outcomes, functionality, and health. Cancer is a devastating and deadly disease. It affects many individuals each year, and many of those individuals are close to home. With the increased rate of prostate cancer diagnosis and death, it is our duty as the care management team to find ways to improve the lives and outcomes for these individuals, as well as those who are at risk within our community. As someone once said, it's not I can survive, it's I can survive. Thank you.